Hi friends, welcome to this session. This session goes with the same direction of how we did obstetrics. So what is the major problem of that is that there are a lot of words, there are a lot of confusions which goes around it, and also people have few complaints saying almost everything has the same clinical features. So here we will have a general template. So based on that, let us go fit all those clinical features for a particular thing. Then let us decipher the overall overview or a bird's eye view for ophthal. Okay, this is only done for ophthal because it's a subject where people always get confused, right? So first I would like to give you an overall overview on how this overall topics goes. Okay, so this is what I would like to show you at the beginning of the video itself. See, this is how we will be planning our whole session. Okay, so what I am meaning to say that is that, so basically if you consider eye, first having an anatomical mind map is something which is pivotal in dealing any of the diseases for that matter. So again, what are from anterior to posterior, first let us list out what are the things which are seen. Okay, first thing is about the conjunctiva. So what are the diseases which you have seen in conjunctiva? One is conjunctivitis and pterygium and pseudoterygium. So we will be dealing with this disease. Okay, then again in conjunctivitis there are various things. Okay, one is allergic. Okay, one second. Okay, one is allergic. Then you also have something in infectional. Under infection, you have a lot of other things. For example, phalanectolar conjunctivitis or angular keratoconjunctivitis, or you might also have chlamydia, that is trachoma, and also your ophthalmia neonatal. Okay, so this is the overall idea which we need to have. Again, coming to cornea, only three things I have to concentrate more on, that is ulcer, dystrophies and degeneration. And degeneration is not equal to dystrophies, and dystrophies itself is not important for your boards. It's a neat PG topic. Okay, you can, for convenience sake, you can just remember three corneal dystrophies and you'll be done. And major important thing under clinical feature which you need to remember is about the pain and photophobia. Then again coming to sclera, again these are the only things which is important. Okay, that is episcleritis, scleritis and staphyloma. Okay, then again anterior chamber, again hyphema and hypopyon are the two things. Hyphema is nothing but blood, hypopyon is nothing but pus. And then again one I've also clubbed glaucoma under this part because again it's something related to aqueous humor. Then again coming to disease of lens, again you might have refractive error or cataract. So again at the end we'll come and revise it accordingly so that we have a conceptual memory of things. Okay, then again coming to uvea, again you will have anterior, middle or posterior or panuveitis. Then again retina and choroid, these are the diseases, and neurophthal, these are the diseases. But again coming to major important thing is eyelids and lacrimal apparatus. Let us club this together. Again, what is the major thing which you see in lacrimal apparatus is the, again dacrocystitis. Can be acute, congenital or chronic. Again that will lead to something as a complication cause dry eye. Okay, then again eyelids, these are the conditions which we'll be studying. One more important thing is about the diplopia. If you see diplopia, mostly likely to be a squint. Then again orbital. Orbit consists of whole box with the iris. Again you might have traumatic or non-traumatic, and these are the overall causes. Okay, this is the overall mind map which you need to have. Okay, so here we will be doing something called as anatomical mind map. Okay, so what does anatomical mind map means? Whenever you are stuck, if you have this mind map in mind, you can write the clinical feature examination science in the easy narration, so that you here the main aim of the video is to reduce your what do you say remembering thing. Okay, that's the main aim. Okay, now coming to the conjunctiva part, as I told, this is the general template so that you don't fall in the confusion of what to do. Again, as I have discussed, conjunctival disorder broadly conjunctivitis and pterygium. So though furtherly again we can classify it as VKC, that is allergic and infectious. And the infectious, again I have talked, again for chronic infections like TB and all, you will have phalanectolar conjunctivitis. Again for Moraxella you will have angular conjunctivitis. Again you can talk about trachoma and also the ophthalmia neonatal part. Okay, so now the major idea starts from now. Okay, so what are we doing now is that, again for all the corneal disorders which we'll see, let us have a general overview of the clinical features and clinical signs which you need to know. Again, what is the for that you should know what is the function of conjunctiva. Conjunctiva is the protective layer, right? And also it's a, what is the major thing? Itis, that is all signs of inflammation which you have studied in pathology can be linked here. Okay, that is one of the important thing which I would like to mention. Okay, so again redness, discomfort or itching, photophobia, all these are signs of your pallor, rubor, tumor, all those things are signs of inflammation. That in ophthal is what I have written in here. Okay, 5 and 5. One more important thing about discharge, I would like to further classify it, because again, if it's a viral, you will have a serious discharge. Again, if it's a mucopurulent, again you have to suspect bacterial conjunctivitis. Again, if it's ropey, then it is allergic. Now you know, when they ask you a clear right clinical features ka part, then you know how to decipher it properly and how you place the disease. This is to give you a general overview of the clinical features, signs of all the anatomical things which are available in the eye, and place it accordingly, and you further can modify it or do whatever you want, so that you are not tensed a day before exam. Okay, so again on examination, these are the things which you should write. Again, while writing examination, again you can first start with external examination. Again, since it's an infection, you have to write about all these things. Then the major thing which you need to talk about is the conjunctiva, correct? Because it's a conjunctivitis and you have to talk about that. Again, majorly, what is the major thing which you need to remember is that you have to, if you are writing follicles, either you have to write it only for viral or chlamydia. Okay, then also you can talk about papilla, and if you are seeing membrane, it has to be either bacteria or adenovirus. Okay, so this is the main examination finding which you need to write. Okay, based on this, you will differentiate whether it's viral or whether it's bacterial or whether it's allergic or anything. Okay, that's the major important thing. Then again, these are the important things which you need to remember. Okay, then again basically based on the location itself. Okay, again, if this is for combining both episcleritis and conjunctivitis. Okay, again, if you are finding it near the canthus, it might be an angular conjunctivitis. If it's near limbus, then it's phylonectular or VKC part of it. Then if it's upper tarsal part, obviously would have studied it's something to do with trachoma. Okay, and these are the limbal signs which you need to remember. Then again for pterygium, it's better if you go watch the case discussion part of it, because again the clinical feature will be almost the same. For example, you will have foreign body sensation. Again, you might have itching. Since it's a foreign body, you might not have any discharge, but you might have photophobia and redness plus or minus. Okay, so that's what I wanted to say. Now you have an overview of the clinical features and examination findings of conjunctiva. Again, you can form the same thing again for treatment also. For example, for all the infections, you have to start on antibiotics, then analgesic. Then again, you have to ask them to take rest, and also have to give atropine for the cyclopelagic. All those things you can form a clinical overall template and fit things which is accordingly you have to fit and come back. That's the overall idea. Then again, coming to the second part, that is cornea. There are only 3 diseases which you have to know: ulcer, dystrophies and degeneration. Forget dystrophies for your board exams. If you want to remember, if you are keen on knowing things, you can remember 3 dystrophies for your sake. Okay, then again, degeneration is equal to what? Keratoconus. Okay, and degeneration is not equal to dystrophy, something which I like to highlight. Again, ulcer, we'll have the same template. Let us dissect it and then make a general template. Again, clinical features, what is the function of cornea? Major thing is about the visual, that is it also gives some refractive power, right? So that is the major thing, and you have to write about the visual symptoms first, that is diminution of vision and colored arrows, and also blurring. Then again, this, since it's an infective or traumatic, so all your signs of inflammation you can write there. That is, whatever I have mentioned can be easily mentioned here. Again, the discharge, based on that you can mention. Again, associated history to come to a proper provisional diagnosis, if you want, you can mention. Again, what is the major important things inside? Again, there the major important thing which you had to mention was conjunctiva. Here, what is the major important thing you have to mention is about the cornea. Again, cornea you can write in and out. Again, circumciliary congestion, you can write it for everything. Okay, any ulcer you can mention about that. Okay, so again, coming to the ulcer location, if it's central, then it might be infective. Again, peripheral, immune. Again, you can forget this because there are no RS questions, right? So basically you have to remember about central and paracentral. Then again, well defined and feathery. Okay, then again base, if you want you can write, but this is the major important thing because this itself is a differentiating factor. Then special investigation, obviously you can write about this. Okay, then again anterior chamber, again you have to mention about if it's a sterile hypopyon or it's a not sterile. Based on that, again you can come and differentiate it. Again, based on pupillary reaction also you can mention about it. These are the special conditions which you need to mention also. Okay, and these are the infiltrates. Now based on this, obviously you know how to go about it, right? Again, same thing. So I just want you to have an overall idea. Now coming to the third important part, that is the glaucoma. So basically your primary, let us, for sake of convenience, let us take it as primary and secondary. Okay, in primary you have POH and PSAG. So what is the major thing? The major thing is, this is chronic condition, this is acute condition. I know even all would have known by this point of time. Now, there are some secondary causes which behave as POAG, and there are some secondary causes which behave as PACG. Okay, now club all those things which behaves as PAOG and club all those things which behaves as PAAG. So these are the conditions which which behaves as POAG. So if you see what is the major thing which you can see, all these are chronic conditions. So it will lead to POAG. All these are what? It's kind of acute. So all will lead to PACG. So again, learn the clinical feature examination findings of this and this. And if they ask about this, place this and come. That's it. Got it. So I wanted to make the memory burden a day before exam less, so that's why I'm giving this. Okay, now again, disease of retina, again it can be vascular disease or macular disease, or it can be a tear, that is retinal degeneration, or inflammatory and degeneration and tumor. So though tumor is important, the major thing which you need to learn is about the retinoblastoma, and again degenerative, the major thing which you need to learn about is the night blindness. Okay, so these are the conditions, or these are the vascular diseases which are there in retina, and these are the clinical feature. Again, if it's a sudden, remember it is always vascular unless proven otherwise. Then again, if you are doing if there's something to do with your gradual, then it's something to do with your chronic systemic conditions like diabetes and hypertension. Okay, then these are the diseases which is there under macular, and these are the types of retinal detachments, and these are the signs which you need to know in inflammation. Again, based on this, these are the clinical features for macular disease. What is the one thing which they are asking? That is ARMD, except that these are not there for your RS, but to have an overall idea or overview, I have given this. Again, clinical feature, obviously these are the two things which you need to mention. Again, if it's a retinal detachment, these are the two things which you have to mention, especially this one. And again, fundoscopy is the core in clinical science. Again, that's the importance of going from anterior to posterior, so you know which clinical signs to mention at which point. Again, here you can write about all the hemorrhage, exudates and cherry red spot. Again, that itself is a 3 marker. Then again, these are the important things which you see in fundoscopy of macular disorders, and these are the things which you see in a retinal detachment, and these are the things which you see in retinitis pigmentosa. Okay, so that's how it is easy. Again, what is the major treatment for this? There is no major treatment. The major thing is about prevention only, except here where you can use photocoagulation. This is the overall general treatment. Again, here for retinal detachment, you can give buckling either anterior, posterior, wherever it is possible. Give buckling support. The major things about retina is how to prevent. Prevention is the key. Got it? Now you have an overall idea. Now go back to that video where we have explained in detail. So based on that, you will have a good idea. Again, or neuro-ophthal, these are the 4 things which are the major. That is color blindness. Again, color blindness. Then there are no RS questions for color blindness except what the test for color blindness. No, so conveniently you can forget. Okay, but the major thing is about these things and these things. Correct, and also optic atrophy. Okay, so again here major things is it's about the gradual painless loss of vision, and also basically about the fundoscopy is something which you need to mention here, and also nerve studies. Okay, these 2 are core which you need to know. Okay, so again, I am not discussing much in neuro-ophthal because the weightage itself is quite less, and also the things which are important is already dealt in a proper way in the major video. Okay, so these are the diseases and these are the clinical features, and so basically why I have not explained a general template for clinical feature is it's not the proper thing. I mean, it doesn't have a proper clinical feature, because if you see visual pathway, again you might have bitemporal and myopia. The major thing is about the blindness, but where the blindness happens is something which you need to know about the lesions of the visual pathway itself. So I have not mentioned about that. And pupillary reflex, what is the major complaint which will have? The major complaint you will have is patient is usually asymptomatic, and again the major examination thing which you need to mention is about dilated fixed pupil. Major thing. Okay, especially about the reflexes is this is I would say this is a diagnosis based on examination. All these pupillary lesions. Okay, it might be RAPD or ARP. Again, that is one of the important thing. And optic atrophy itself. These are the conditions, and you need to know in and out of it. Okay, lens. So again, before lens, what is thing which is front of it is anterior chamber. Obviously you have hyphema or hypopyon. You can study about that also, and if this is not going, what is the major thing? That is glaucoma. Okay, now lens itself is an important thing. Again, major components which are important in cataract is what? Congenital cataract or acquired cataract, or if this has not been solved, again you might have after cataract. Okay, so again in a major thing is what? Again it's a gradual painless loss of vision. What is the major thing which major management of cataract? Surgery. Again, all types of surgery you can write SICS, CCC, all conventional, all those things you can mention. So having a general overview or general idea is what I wanted to give you. Again, refractive errors, again emetropia means normal, again ametropia or some special condition. Under ametropia, you might have spherical errors or non-spherical errors. Again, spherical errors is what? Only in the sphere of that. Again, you might have myopia or hypermetropia. And other types you will have astigmatism. Okay, then what is anisometropia? That is when one eye has other image and one more eye has other image. That is something but anisometropia. Then special condition, again you might have aphakia, pseudophakia, presbyopia. Then based on this, again what is the major thing which again here you cannot have a proper clinical feature itself, because here you will have nearsightedness, there you will have farsightedness. So again presbyopia, again you will have age-related things. So again a general thing cannot be given, but here what is the major thing which I would mention is about the blindness, and you need to check about the visual acuity. Based on visual acuity, you have to write about the examination finding is what I wanted to say. Clear? Okay. Now, and I also again, while talking about the treatment, it's basically about the lens, especially for the refractive errors, and obviously for the cataract itself. Also, you have to go about IOL, and also you need to calculate the power of IOL using SRK formula, other formulas which are concerned. Okay. So this, I hope you are getting the general overview which I wanted to give. Then again, now since we are gone from anterior to posterior, let us look something which is outside also, that is eyelids. Okay, so basically from eyelids, what are the eyelids and lacrimal apparatus also. Okay, let me draw a lacrimal apparatus. And so this overview itself, if you have, I am sure you can write some clinical features and you don't get confused. Okay, so again inflammatory, you might have audiolum or callosium. So what is the major thing? Again, callosium is painless, but audiolum is painful. So callosium is always a cosmetic problem, so you go with incision and curettage and not drainage. Got it. Then blepharitis is nothing but crusting of lids. Okay. Again, what are the malposition things which you can see in eyelids? Again, you might have ptosis or entropion, that is inside, ectropion, that is outside, or lag of tonus. Again, structural thing, the major thing which you need to write in the clinical feature is about the foreign body thing, because it's the hair. Again, you might have trichiasis, dischiasis, or coloboma. Again, tumors, not an RS, but if you, for the sake of completion, you must have sebaceous carcinoma. Okay, what are the major things which, as the clinical feature you will write? Again, the star of information, that is the importance of pathology. Okay, that you can write. And here again since it's a malposition, what is the thing? That is, one thing is obviously about the cosmetic thing, and obviously about the foreign body thing, which is common for structural also with irritation and watering you can write. Okay, but in lag of tonus, since it's not drooping down, then obviously you will have dry eye, which is the continuation of lacrimal apparatus, where you will at the end it will lead to dry eye. Okay, so especially in the examination findings, what is the major important thing which you need to mention? About the external examination itself. Correct. So I hope you are getting that idea so that you are not getting confused. Okay, that's the major aim. Again, these are the cystitis which you will have, which will lead to dry eye. Again, you need to manage it by giving artificial tears. Again, for diagnosing it, you will use streamers. Okay. Now coming to uvea, again you will have anterior or intermediate or posterior, or you will have pain. These are the common clinical features which you can write for all. Okay, but the major thing which I would like to emphasize is on the examination finding which you need to write. Again, anterior is more of infective, but again intermediate and posterior is most of severe vision loss, and flow. Intermediate is it doesn't have pain and redness, going with the same things, but the major thing is major complaining feature of the patient is floaters. Then major thing, it's an anterior uveitis. So anterior chamber is something which you need to examine very well. In intermediate, vitreous is something which you need to examine very well. In posterior, you need to examine the fundus. Okay, see this line. So again, you can write about everything, but these has to be boxed or highlighted is what I am saying. What you will see in anterior chamber, you might have cope-nodules, or you can have hypopyon, or you will have cells and flares. Again, in vitreous, what you will see, again, all this snow banking and all those things. And basically, you have to write about exudates. Okay, everywhere you can write about. The common thing which you can write is about the exudates. Common clinical feature itself is what? Floaters. Okay, so for panuveitis, merge and write everything. Okay, then also treatment and management is again the same. You have to find out the etiology, whether it's infection or autoimmune. Again, if it's autoimmune, immunosuppressant. Again, if it's infection, one you have cycloplegic, and rest you can write it for everything. Okay, then if it's an infective, you have to give antibiotic, if it's bacterial or something. That overview I want. After that, you can go and write anything you want for your sake. Okay, but I don't want you to miss the proper aspect, okay, proper understanding is what is my concept. Then squint, again paralytic, non-paralytic. This if you want you can remember, this you can forget. The major complaint is what in the manifest squint is diplopia. Again, squint is not an high weighted topic, okay, so I'm not explaining must. I know there is Madaxlab test and also you need to do all those tests, but the major idea is what? The major idea is whether you know or to differentiate between paralytic and non-paralytic, because that's the only RS question. Correct. Now you need to gear up to solve RS questions, because now you have just 10 days for that matter. Correct. Again paralytic, it's something to do with nerve, right? So it might be sudden in onset diplopia, but again in non-paralytic you might not have it, but the major thing is it's seen in children and they might have amyloidopathy. Correct. Have general things in mind, that's what I would say. Then again orbit, the major thing is orbit is something where I rest. Again you might have traumatic and non-traumatic. For convenience sake, let me club all this under non-traumatic. And traumatic you might have lower fractures and also chemical injuries also. Okay, but these are the things which you need to know in non-traumatic. Again, if you ask me, this is not important, and this is also they have not asked, but these things are important. Again, what is the major thing is diplopia and restriction in upward case, and in thyroid eye disease you will not have any pain and also retraction. Again, you need to learn about the thyroid eye signs. This is not important at all, but you need to know about these things, and in an infective mention about the star. Correct. Then coming to sclera, again for convenience you can forget this, and also to an extent you can forget this also, because once I think it's an RS3 paper, once they are asked. But the major thing is you should know to differentiate between scleritis and episcleritis, and major clinical thing which you need to know about is if it's a scleritis you need to rule out or the autoimmune or chronic granulomatous condition. Correct. And also about staphyloma, it's nothing but thinning and it's also bulging, so you will have reduction in vision. Got it. Now this is the overall overview which you need to know. Again in conjunctiva, see again let me be very clear. I have left pharmac part, surgical part, and I hope only these two things, and also PSMA I have community of that. Okay, so these things I have left. But these things, if you study, you will understand. No, I don't think I have to come. I mean, I have to make a separate thing for that. But the major thing is, I don't want you to go out with the idea, with that saying that there's so much to study. There's so much to study. If you start studying one disease individually, there is so much to study. But always have a template. If, for example, if you have an infection, form a general template for clinical feature, form a general template for investigation, form a general template for management. Use it for any subject. For example, malignancy. Let me give an example for investigation. Again, to screen the disease, to stage the disease, then for follow-up broadly. Again, for specific things you can mention specific things also. Again, retinoblastoma I have not mentioned, because that what is the major thing there you have to remember is about the white reflex. Again, major things again in cornea which I have left is about the keratoplasty. Okay, keratoplasty, and also one more important thing if I am not forgetting is that layers of cornea. Okay, layers of retina is also important. Those anatomy physiology questions I am not discussing now. Those are things which you should know. Based on anatomy itself, we are trying to delineate and give a proper conclusion and proper understanding. Okay, not conclusion here, but proper understanding on how to go about the ophthal subject as such. So based on this, now you go and watch that part of ophthal which I have explained. So now if you go and see, this is the proper understanding of ophthal. Okay, but go and see the weightage. Conjunctiva, cornea, glaucoma, and one more 10 marker is retina and choroid. Okay, I made sure these three things I have discussed in detail. Then lens and refractive eye also I have taught. Then eyelid and these two systems is combined. Okay, right as we have talked. Then again strabismus is 3 mark, so I didn't discuss much about that. Overall idea is something which I would like to give you. Again, in glaucoma I have not discussed about anti-glaucoma drugs also. Okay, there are many things which I have left, but what is the aim of the video is that you should not write nonsense clinical features and examination findings for other things. For example, mentioning about follicles in an vernal keratoconjunctivitis is wrong. Correct. Or mentioning about membrane in vernal keratoconjunctivitis is rubbish. Again, trachoma, a few things I have mentioned because I don't want you to in limbal science itself. Okay, again, trachoma is most important, but I have not mentioned. But what is the overall idea I wanted to give? Overall idea is that I wanted to fit disease in particular pockets so that you don't forget, especially clinical feature and examination, because treatment protocol is almost same for infective, and the major thing is you will deal about infective or vascular. Again, prevention thing you have to write. Again, for ophthalmia neonatal, if you don't write about the prevention of it, again there is no point. Okay, so use this and watch that video. I'm sure you will be in a good clinical position to answer anything in general, because I told 60 marks you can predict, 40 marks you cannot predict, but with general template use everything and whatever knowledge which you have acquired in these 3 years and answer it. That's what I would say. Okay, I hope this adds some, I did some justice to this subject by doing this video. Thank you.